I just want to share my bitter experience. I lost my mom recently due to COVID. She was admitted on the 12th of April in a hospital in Chennai. They wouldn't admit unless I paid about 50 grand, which I did in rupees. And the CT scan said that her lungs were infected. She was on oxygen 50 liters for about 4 to 5 days. And on the 18th, she was shifted to a BiPAP phase ventilator, high pressure ventilator. And the doctors told me that her lungs are sick and she's not coping well. And within a day, on the 19th, the doctors called us and said, if you want, you can shift her to a different hospital. She's just giving up. We asked the doctor what is the problem, and they said they don't have the vital injection that Remdesivir did, and they're not in stock, and they couldn't find it anywhere in Tamil Nadu. So we promised the doctor that we will arrange the medication, and which we did to my brother-in-law. We found some source in Bangalore, and before we could deliver the medication on the midday of Tuesday, early morning on Tuesday, they called us and said my mother is having a cardiac arrest. And before my brother-in-law could reach the hospital, they declared my mother dead. They knew this information all day long, and they never told us, and they kept the information that they have no stock of medication until the last minute. I believe my mom died not because of COVID, but only because of mismanagement of the hospital. It's really bad. I don't know whether I'm supposed to cry for my mother or I'm supposed to cry for all the Indians who lost their loved ones in India. It's total mismanagement. I'm really, really disappointed with the Indian government. Very bad. Sorry.
I have with me a software professional from the US who is on vacation in Chennai, but his parents, both of them, have tested positive, and he finds it difficult to get them the crucial Remdesivir injection. How difficult, how are you struggling to get this, if you can share with us your experience?
It's definitely not straightforward. I have been trying to acquire this particular injection for almost a day and a half now. I've been calling all the hospitals. Some of them confirm that the patients have to be an actual outpatient for them to go ahead and sanction or administer this particular injection. And some of them, most of them, largely they don't even have stock of this. So the situation is not exactly adequate for severe COVID symptoms or patients with severe COVID symptoms. So it's been really hard, but I'm still trying, and I hope that I can get it probably by end of day through some source. Yeah.
And what is their condition? How are they?
They have escalated symptoms. They have lung infections. We already confirmed that with the CT scan, and there's fever. There's the regular COVID symptoms with them. It's been 3 or 4 days. The only factor that plays in largely is the age. So they are 69 years old. So that's where the concern is, which is why I'm trying to secure this particular injection at the earliest.
And how are you trying?
Just ringing up through all my doctor friends, my medical representative sources, calling the hospital lines directly, the pharmacies, jumping from one hospital to the other, also with the help of the current physicians and doctors that are trying to help us out. So it's never going to be enough with just one approach. I'm just trying to expand my wings, try through every source that I know.
What do they say?
Most hospitals, they don't have the stock. Some hospitals need you to be an actual outpatient for you to administer the injection. So I can understand that for large hospitals, there's a possibility they have some stock. But for smaller hospitals that are close by to your house, where your parents or your relatives are admitted with extreme severe lung congestion as a COVID side effect, it's not really straightforward to get the injection.
How's the family feeling?
They're on and off, but we are all primarily focusing all our energies into getting this and not looking back as to what might or what we could have done. So we are just trying at our best to somehow get this injection. All of us are working towards it, COVID or not. So that's all we are trying to do at this point.
Thank you very much. We hope that you would get that very soon. An indication of how difficult it is for patients like this young software professional across Tamil Nadu, particularly in Chennai. But the government says they have placed an order for 2 lakh vials, and that they're also distributing Remdesivir on a case-to-case basis for those patients in private hospitals. The Chief Minister has also written to the Prime Minister to ensure that the bar on supply of Remdesivir is lifted and that it's accessible to all states equally. shortage of life-saving drugs like Remdesivir, particularly in private hospitals. Hospitals make patients or their families run around with prescription. What's being done about it?
Yeah, this was also brought to our notice. Remdesivir and all the life-saving drugs are directly handled by the health department of the state government, and there is a Tamil Nadu Medical Services Corporation. In fact, yesterday a respected chief secretary conducted a very detailed review meeting with all the officials, GCC and all collectors and all, on stemming the tide of this COVID. This point we flagged it to the health department and specifically to Tamil Nadu Medical Services Corporation. They are on to it, and they have given word that in a matter of few days, the shortage of Remdesivir and all other essential drugs that the health department handles will be sorted out. There was certain gaps in that because every state and every organization, every government is on to the job of procuring all these things like never before. So there is always some, in this dire circumstances, there will always be some kind of supply chain issues. So that is being sorted out. In my opinion, and from the mood of yesterday's meeting, what I could sense was in a couple of days all these things will be streamlined.